Good evening, Missouri City, and Happy New Year. I'm Councilmember Anthony Maroulis from District C, and this is our first COVID news and conference for 2022. 4 days ago, our nation reached a calendar milestone with the start of a new year. Then 2 days ago, the United States reached a COVID milestone, reaching more than 1 million cases. And yesterday, the state of Texas reported a record of more than 44,000 cases. These numbers represent a stark reality for everyone. We are all struggling with the coronavirus, and the pandemic continues to impact the citizens and our city. Here at home, a disaster and local declaration remains in place, and your city council, appointed officials, city management, and the EOC team closely monitoring the emergency pandemic every day. We know the seriousness and severity of this virus, and we're working around the clock to protect you, our citizens, and the people in our city. This variant accounts for 95% of the new COVID-19 infections, and according to the CDC, the rising numbers continue to grow. And cases and hospitalizations are also increasing as healthcare professionals are working around the clock to protect us. They're overwhelmed, and a lot of patients continue to come in. And we know there's a lack of staff and resources in the healthcare environment. Local schools and businesses are also impacted with workforce shortages and limited resources. We need to take care of our families. We need to be proactive. We need to take care of our friends and our neighbors in this crisis. If you, a loved one, or a colleague are experiencing COVID symptoms, I urge you to please test. There are testing methods that you all can practice at home. Find out the facts from your doctor or a nurse. Do you have a cold? Do you have the flu? Or do you have COVID? And then quarantine. Social distance, follow the doctor's recovery guidelines, use PPE, and monitor your health. Your well-being and your family are important, and they come first. Stay informed, stay aware, stay safe in the Show Me City of Missouri City. Now, City Manager Charles Jackson will provide an operational update and provide some strategies that are in place to keep our employees safe. Manager Jackson.
Good evening, everyone. I'm Charles Jackson, the City Manager. Thank you for tuning in to our first coronavirus news conference of 2022. Staff and I are watching COVID developments, and we are closely monitoring the number of cases in Missouri City. As we collect data, we are sharing local numbers, healthcare tips, and safety guidelines with our residents, businesses, and stakeholders in real time. For current information on positive cases, testing sites, vaccine locations, PPE availability, city actions, and these special broadcasts, please watch the city's websites and our official Facebook, Instagram, Twitter, Nextdoor, and LinkedIn accounts. The city will continue to take a proactive approach to the pandemic so that we can ensure the safety and well-being of all employees and the public that we serve. We're less than 2 months away from the 2-year anniversary of COVID-19 being officially announced, recorded, and treated as a new virus in the United States. Unfortunately, the recent surge of positive cases over the past month brings back memories of how our city struggled with the pandemic in March of 2020 and the months that followed. Schools were closed, businesses were shuttered, hospitals and medical professionals were devastated. Cities and public servants faced an unprecedented epidemic that challenged their first responders on the front line. The difference today, especially for local government, is that we are better equipped with the appropriate resources that help us better serve you and to govern our jurisdictions. For city employees, we have COVID testing readily available, we have vaccination information, we thoroughly clean workspaces and common areas, we have temperature scanners, and we supply team members with masks, hand sanitizer, and wipes, social distancing guidelines, and other essential resources. As Missouri City moves forward strategically to provide excellent programs and customer service, we need your help to stop the spread of COVID-19. We can't manage this destructive virus without your cooperation. In your daily routines at home, at work, at school, and at extracurricular activities, please follow the 3 W's. Wear a mask, wash your hands, and watch your distance. In line with our city credo, together we will excel, and together we will beat COVID-19. Thank you for your support, Missouri City.
Good evening, Missouri City residents. My name is Mario Partita, your fire chief for Missouri City. I will be introducing a couple of important partners to provide you more information on our efforts, and then wrap up with a report from the Fire and Emergency Operations Center, as well as wrapping up our session with questions and answers. At this time, I'd like to introduce Dr. Joe Anzadua, who is our health authority, and he'll present more in-depth information about this new variant and the overall impact it's having on our communities. Dr. Joe Anzadua.
Good evening, and thank you for having me. So there continues to be record-breaking numbers of COVID-19 cases throughout the country, and our area is no exception. The significant increase in cases is mostly felt to be due to the Omicron mutation, which has essentially taken over the Delta mutation. But even though these cases continue to increase, there has not been a simultaneous surge in hospitalizations or even death that we experienced with Delta. So this is good news. This is what people have referred to decoupling or uncoupling. You may hear those terms. So the significant rise in cases have been decoupled or uncoupled from the smaller rise in hospitalizations and deaths. Now, I in no way want to minimize the impact that these mutations are having on our current healthcare system, especially our hospitals. It's a serious problem. A record high number of COVID-19 cases is still occurring among all age groups, including children. In fact, Texas Children's Hospital, located at our Houston Medical Center, recently reported a 4-fold increase in hospitalizations. And a significant increase, as was seen in South Africa, is being seen in ages 5 years and younger. This shouldn't be surprising to people, since this remains the only group of people that are not eligible to be vaccinated as of yet. So I want to emphasize that with Delta, we saw a simultaneous increase in hospitalizations and deaths as cases were going up. That does not appear to be the case with Omicron. So we are not seeing the surge in hospitalizations and deaths we saw with Delta, even though there are record-breaking cases of Omicron as compared to the Delta virus. But again, it appears that the Omicron is resulting in much milder cases compared to Delta. Omicron infections do not seem to spread into the lungs as we saw with Delta. This may explain why we have not had a surge in use of ventilators in our ICUs and hospitals. Omicron has now essentially displaced Delta as a major driver of viral transmission in the US and probably many other countries. And there are many experts who believe that this may very well spell the end of this pandemic, ushering in the endemic phase of SARS-CoV-2, the virus known to cause COVID-19 illness. So I remain optimistic and hopeful as we enter our 3rd year of this pandemic. Time will tell. The Omicron variant appears to be a situation where this virus is highly transmissible or contagious, but not as virulent as compared to Delta. So I want to explain the difference between contagiousness and virulence, since sometimes these terms tend to be confusing to a lot of people. Contagiousness refers to the high transmissibility of the virus, as we see with Omicron. That means that the virus easily spreads, and it spreads fast. Virulence, on the other hand, refers to the actual illness, bodily damage, and even death caused by the virus. So again, Omicron is very contagious, but does not appear to be as virulent, which would lead to severe disease or death, as you saw with Delta. So again, I think that's good news. Now, recently, the CDC has given some updates that shortens the recommended period of time someone should remain in isolation or quarantine. And again, I would like to go over the definitions of isolation and quarantine as they often do, as they're being used today, and sometimes can be confusing to some people. Isolation refers to the separating sick people with the virus from people who are not sick. So if you are sick with the virus, you should isolate. Quarantine refers to separating people who are not sick, but who have been exposed to people that are, and therefore at risk of becoming sick themselves. So let's talk a little bit about isolation first. If you test positive for COVID-19, the recommendation now is to stay home for 5 days, regardless of whether you have been partially vaccinated, fully vaccinated, or unvaccinated. According to the current guidelines, a person that is isolated for 5 days can take a rapid test at the end of the 5 days if they want to, but it's not required. So, if you decide to get tested for COVID-19 at the end of the 5 days and you test positive, you should continue to isolate until 10 days after symptoms started. If you decide to get tested but are negative, it's okay to leave isolation, but you must wear a mask for 5 additional days. And it is okay to travel after day 10. Again, testing at the end of the 5 days for a person in isolation is optional and not required. It's my opinion that people in isolation should make every effort to get tested, however. Now let's talk a little bit about quarantine. If you have been exposed to someone with COVID-19, you will need to wear a mask around other people for 10 days. You should try and test on day 5 if possible. If you develop symptoms, you need to get a test and stay home. So now you're back to isolation. This applies only to people that have completed the vaccination series as recommended, and especially if you've received the booster dose. Now, if you have been exposed to someone with COVID-19, but you have not completed the vaccination series, or you are not vaccinated, it is recommended that you stay home for 5 days. After that, you should continue to wear a mask around others for 5 additional days, and you should again try to test on day 5 if possible. And again, if you develop symptoms, you should get a test and stay home. I know these guidelines can be very confusing, but it's very important for you to understand what's going on. I would recommend that you go to the CDC website and review these guidelines at your convenience and at your own pace. I do want to mention a couple of antiviral medications that you'll be hearing about in the next few days to weeks to come. And there will probably are others that are on the way. The first is a drug called Paxlovid, which some people are referring to as the game changer. It appears to be the most promising option so far. Studies showed a significant reduction in hospitalizations and deaths among people who took this drug compared to those who took placebo. So placebo is a sugar pill. In other words, placebo pills have no therapeutic value. The problem right now is that it will take several weeks or months for this drug to be widely available at the pharmacies, and they will need to be prescribed by a licensed healthcare provider. Another medication called molnupiravir does not appear to be as effective, but more studies will need to be done. And again, there are more drugs coming down the pike. I want to talk a little bit about monoclonal antibody treatments. Unfortunately, with the exception of one called sotrovimab, the current and widely available treatments, including Regeneron, are not very effective against Omicron. And the one that I just mentioned, sotrovimab, that is quite effective, is still not widely available. I want to talk a little bit about vaccination and boosting. The data from South Africa, where Omicron had its start, demonstrated that the vaccine effectiveness against Omicron using the 2-dose series of the messenger RNA, like Pfizer vaccine, was about 35%. Not very good. But data also showed that a COVID-19 vaccine booster restored effective vaccine effectiveness against Omicron to 75%. Now that's very good. So COVID-19 vaccinations have been shown to decrease the risk of severe disease, hospitalizations, and even death from COVID-19, and even better with the booster dose. I'm gonna, in a while, Dr. Mona Finley will talk about, more in depth about vaccinations, so I'll leave that to her. I do wanna reemphasize, don't forget the 3 W's. Wash your hands, watch your distance, and wear a properly fitted face mask that covers your mouth and your nose. This is especially important in large crowds, in small confined areas with poor ventilation. And a final word on our flu season. Flu activity is still low across our nation, but cases are steadily increasing. Most flu infections have occurred among children and young adults ages 5 through 24 years old. But infections occurring among adults ages 25 and older have been steadily increasing. Hospitalizations for flu have also started to increase. Flu season is just getting started, so there is still time to get vaccinated. So please, check with your healthcare provider or go to your local pharmacy that provides flu vaccines. CDC recommends that everyone 6 months and older should get a flu vaccine. Thank you, stay safe, and stay healthy.
Thank you, Dr. Anzaldúa. Now, I'd like to introduce small business owner Dr. Mona Finley, who will provide an update on vaccines and tests offered at Glen Lakes Pharmacy. She will also let you know how to register for a vaccination.
Happy New Year's, Missouri City residents. I would like to give you an update on the vaccines. COVID-19 vaccines are currently available for 5 years of age and older. Ages 5 to 17 can only receive the Pfizer vaccine. Ages 18 and older can receive Pfizer or Moderna. Boosters are available now for 12 and older, 5 months after their 2-dose series of the mRNA vaccine, which is the Pfizer or the Moderna, or 2 months after their J&J single dose. Boosters can be mixed and matched, but only for ages 18 and older, which means they can switch to a different vaccine of their choice from their original vaccine. CDC recommends an mRNA COVID-19 vaccine instead of the J&J due to the reports of thrombosis. What to expect when you come to get your vaccine? Please bring your previous vaccination card. Side effects that you may experience as your body builds protection against the virus: pain, redness, swelling at the injection site, tiredness, headache, muscle pain, chills, fever, and nausea. There's a mechanism to report your side effects to vSafe, which is a smartphone-based tool to communicate with CDC to help monitor the safety of the vaccines. And we have that information when you come by Glen Lakes Pharmacy to receive your vaccine. Most recently, as Dr. Anzaldúa mentioned, there are 2 oral COVID-19 antiviral pills that were just approved under EUA for treatment. There's the Pfizer Paxlovid. It reduces hospitalization or death by 89% in comparison to placebo. There's Merck's Molnupiravir, which only reduces it by 30%. Eligibility for these pills are: Pfizer, you have to be 12 years and older, weighing at least 40 kilograms or 80 pounds. And for Merck, you have to be 18 years and older. You have to have mild to moderate symptoms, test positive for the SARS-CoV-2, and at a high risk for progression to severe COVID-19, including hospitalization or death. The pills must be given within 5 days of the symptoms onset. It is not authorized for pre or post prevention. Very important, it is not for prevention, it is for treatment. It is not a substitute for vaccination, for whom vaccination and a booster dose is recommended and available. And as we know, vaccines are readily available. The dosage is 3 tablets twice a day for 5 days. So you will be given a prescription by your healthcare provider for 30 pills. The side effects of the medication is loss of sense of taste, diarrhea, high blood pressure, and muscle aches. There are quite a few drug interactions, so not everyone is eligible depending on the medication that you're already receiving. Just to name a few: HIV-1 drugs, analgesics, which is pain medications, heart medications, anti-cancer drugs, anticoagulants, anticonvulsants, antidepressants, antifungals, anti-gout, some antibiotics, antipsychotics, migraine meds, herbal products, statins such as lovastatin and others, immunosuppressants, sedatives, and corticosteroids. It is contraindicated in patients that have severe hepatic, meaning liver. Severe renally impaired patients it's also contraindicated. But you can talk to your healthcare provider. Some of the questions that we receive at the pharmacy on a daily basis, they have questions about the oral pills, when they will be available. I've already been getting prescriptions, phone calls. It's on its way. We don't know exactly the date that it will be on the pharmacy shelves, but we have not gotten it yet. I don't think it's readily available anywhere just yet. It's probably going to be in limited supply, but as of now, it is not available. Some of the other concerns is ivermectin. Good pharmacy practice from the State Board of Pharmacy says that we are not to dispense ivermectin for treatment of COVID-19. So patients that are calling or coming by and say they have a hard time finding it at any pharmacy will probably continue to have that same problem. Ivermectin is not to be dispensed for the treatment of COVID-19. Tests are very difficult home tests to come by. However, you can get testing. There are several free sites where you can go to. Fort Bend ISD just opened a site today at the Wheeler Field House, which is over by the Fort Bend Annex building, from 6 a.m. to 2 p.m. today, tomorrow, Friday, and Saturday. Also, Fort Bend County, if you go to their website, you do need to make an appointment. You go to their website and find out where you can go and get a free test. And the city of Houston have free testing sites as well. We also get inquiries for Jnj Vaccine. It is, as I mentioned earlier, it is not recommended by the CDC to get the Jnj Vaccine due to thrombosis. You can switch to Pfizer or Moderna. You can register to receive a vaccine at Glen Lakes Pharmacy by going to tinyurl.com/G Girl L Larry P Pharmacy Vaccine. Thank you very much.
And I'd like to provide you an update from the fire and EMS response as well as the Emergency Operations Center. While we've had some impact to some of our staff in the fire stations, we still remain fully staffed at all the fire stations with your fire and EMS first responders. We are prepared. We have plenty of PPE, and while we're guarded, we have not seen an increase in EMS calls related to COVID. We've remained pretty stable. I'd like to provide you some statistics for Missouri City, specifically for Missouri City. Communications Department is doing a great job posting these numbers on our website, but today's numbers for Missouri City are cases in Missouri City are 1,876, with the breakdown of cases in Fort Bend County portion of Missouri City at 1,767, and for the Harris County portion of Missouri City, 109 cases. While this was expected coming off the holidays and with increased testing, We'll continue to monitor and provide those numbers to you through our communications department. In regard to our Emergency Operations Center, we are on standby at this time and we are monitoring. We are not activated, and we stay in contact with our neighboring departments as well as the counties to stay consistent with what everyone is doing in regard to EOC activations. And everyone is kind of in the same posture where we're just monitoring the situation, and we have staff available in the event we need to activate the Emergency Operations Center. Currently, we do not have any scheduled county or statewide conference calls related to COVID, but we stay in touch, and they will let us know when and if they activate any of those conference calls again. In regard to community support, we have plenty, the city has plenty of adequate PPE kits to distribute. All the departments are distributing PPE every chance they get at events and at meetings. So we have plenty of PPE to go around. If you have a need for PPE, check our website, as well as you can call 281-403-8500. Again, 281-403-8500, and we will make sure that you get a PPE kit. So we want to make sure all our citizens have those kits available. At this time, I want to thank everyone for watching, and we will now have our regular Q&A session. Please post your questions and comments on our Facebook page, and our panel of experts will answer your questions or try to answer your questions. Do you have questions?
Dr. Anzaldúa, we have a few questions for you to start. Sir, some experts are urging teenagers as young as 12 to get boosters as soon as they're eligible. Can you share any insight on this recommendation or this news?
I don't have any extra information regarding that. It's a CDC recommendation, and they've done their own studies along with the other agencies, including the NIH and the FDA and the ACIP, in conjunction with the ACIP, which is the organization that sets our standards for vaccinations, and they're the ones that are recommending that. I don't have any more information. Again, all this is brand new. These guidelines have just recently changed. And I also want to add that the guidelines seem to be changing quite often. So please go to the CDC website and stay up to date on things, because things are changing. I do want to clarify one thing regarding the boosters. Like Dr. Finley said, the length of time from finishing the primary series to the booster, it's 6 months. It's been shortened by the CDC to 5 months, but it only applies to the Pfizer vaccine. It does not apply to Moderna or J&J. Those are still at the regular times, 2 months for J&J, and then I believe it's 6 months for Moderna. So the 5-month shortening only applies to those people that received the Pfizer vaccine. Thank you.
There's several others for you, Dr. Anzaldúa. I'm sorry. You talked a little bit about hospitals and how they're dealing with Omicron. What are you seeing locally in terms of our hospitals and how they are being impacted by this new variant?
Okay, Stacey, I need to ask you to repeat it because I can't understand. I did not understand you.
So many hospitals are being impacted by the new variant. What are you seeing locally as it relates to Omicron and our hospitals?
We're seeing pretty much what everybody else is seeing. There's a significant increase in cases and hospitalizations. And that's the bad news, because we're already burdening and already burdened and stressed healthcare system. You know, there's fewer nurses than there used to be for many reasons, but the whole system is very, very burdened. So we are seeing an increase in hospitalizations. The good news is that the people that are being hospitalized are leaving the hospital. Their illnesses are a lot milder than they were with Delta vaccine.
And speaking of current effects, can you talk a little bit about night sweats? A lot of people are reporting night sweats from Omicron, and that's a difference in what they've experienced before.
Yes, it's recently been reported that a symptom that stands out for Omicron is night sweats. Now, why that occurs, we do not know. We see night sweats in people that have certain diseases like TB or even cancer. As to why Omicron is doing this, we don't know, but obviously people in my field that are talking to patients, screening patients, interviewing patients, we will be asking more and more about night sweats. As to what's causing that, we do not know. That's something that just came up in the news.
And then also, there's an unapproved fourth dose of the COVID-19 vaccine that many people are getting, according to news reports. Have you heard anything about that, and has that been an issue locally?
The CDC has recommended a fourth dose for very limited population, and I believe that population are immunocompromised people that are very high risk of getting sick. Again, that's a very small population.
Thank you. And if people need to travel at this time, what are your recommendations?
Well, my recommendation is, if at all possible, don't travel. I mean, if it's important, there's a family emergency or someone is ill and people have to travel, that's fine. But I think travel should be rather limited. The airlines are doing a very good job trying to keep people safe. But then again, the airports are probably the bigger issue, where you have a lot of people crowded into very small confined areas. Some people are masking, some people are not. It's a very intense situation there. So if at all possible, if you don't have to travel, it's best not to.
Okay.
And the form of travel that people are most worried about right now is cruise ships. That seems to be the bigger problem, and it stands to reason, because think about it. You have all these people in a very small confined boat in the middle of nowhere with no place to go, and despite everybody's efforts at hand washing and wearing masks and all that, we still are getting outbreaks in cruise ships. So I think the CDC has come out and really discouraged the use of cruise vacationing right now.
And there was a recent case of that. So what happens? Do the passengers have to remain on the ship until everyone is cleared? Or what do medical experts do in situations like that?
It depends on the situation. A lot of times they will not let people off the ship until they're satisfied that they can handle them, or they're able to put people into isolation. But sometimes these ships are going into a port of call, and they're having difficulty getting accepted into that port. So it depends on the situation.
If people need to host or attend an event at this time, what are your recommendations?
It's the same thing. I think that if at all possible, if you can avoid it, even if you're fully vaccinated, everybody understands now that people are getting breakthrough cases, even if you're vaccinated. If at all possible, just try and stay away from large crowds. If you have to go into large crowds, you need to wear a mask and distance as much as possible, although that's hard to do during large crowds. Again, the difference between this virus and the Delta virus is that this virus is very, very transmissible.
What is the current deaths and recovery rate as it regards to COVID at this time?
I don't know what the recovery rate is, because right now we're in transition from the Delta data and the Omicron data. The death rates for Omicron look a whole lot better than we were seeing with Delta. People that had Delta, we had much higher death rates. A lot has to do with the fact that the Delta virus seems to infect the lungs a lot more dramatically than the Omicron does.
Thank you, Dr. Anzaldúa. Dr. Finley? Thank you for joining us today. One of our viewers asked, can you reiterate again the testing options that are available at Glen Lakes Pharmacy?
So currently, we do not have any home test. We do not do any testing in the store. However, there are quite a few free sites that you can go to. Fort Bend ISD has it from Wednesday all the way to Saturday from 6 a.m. to 2 p.m. at the Fort Bend Annex Building, which is over at the Wheeler Field House. And also Fort Bend County, if you go to their website, you do need to make an appointment with them. And you can go to their website and find out. I think they have 4 different locations. And the city of Houston has several locations that you can go to for testing.
Thank you. Should people get flu shots in addition to COVID vaccines and boosters?
Yes. I definitely recommend for you to receive your annual flu shot along with your COVID shot. For those who are unvaccinated, you possibly have a weakened immune system if you contract the flu as well as COVID. So I do highly recommend that you get the flu vaccine.
Do you know what the flu numbers are for our area?
I don't have any numbers, but I do know that it is low. It is low. The mask really helped. We saw that last year. Flu was almost non-existent with the washing of the hands and the distance and the wearing the mask. But the numbers are again low this season.
And is Glen Lakes Pharmacy seeing a higher rate of test and vaccination registrations since the surge?
We have, and it's very enlightening to see first-timers come that have not gotten the vaccine. We have been very busy with patients getting the vaccines, the first dose, second dose, as well as boosters. Yes, we've had quite an influx.
Are there any side effects from the boosters that you're seeing?
As I mentioned earlier, fever, chills, pain, redness at the injection site, headaches, muscle aches is a potential. I always counsel patients, it's not promising, but most likely what side effects you experience on your second dose is likely to happen with your booster.
And once again, can you share the tiny URL link, also the address for Glen Lakes Pharmacy and a phone number with our viewers?
Sure. So we're located at 3640 Glen Lakes Lane here in Missouri City. That's at the corner of Glen Lakes and Highway 6. Our phone number is 281-261-8278. And to register for the vaccine, if you go to tinyurl.com/GLP vaccine. That's G, girl, L, Larry, P, pharmacy, vaccine.
Thank you. Dr. Anzaldúa, we have 2 more questions for you, please, sir. Do the tests indicate which variant a person has? How can they know which variant they are dealing with?
There is a way of somewhat indirectly determining if they're dealing with Omicron or Delta. There's no definitive difference, however. But again, probably 95% chance if you test positive, it's because of Omicron, not because of Delta.
And also one last question. What is the difference between the symptoms of a cold, of the flu, and of COVID?
Oh boy, what a great question. It's a question that I don't have a very good answer to. In many ways, they're similar. So this is why it's very important that if a person has symptoms and they're not sure if it's just seasonal allergies or whether it's their annual sinus infection or a bad cold or the flu or COVID, it's always best to call their physicians so that they can ask them a series of questions that can help them pinpoint them or direct them to what is the most likely scenario, and therefore recommend testing, come to the office, get some antibiotics, whatever the situation is. But this is very difficult for people, for the general public to really discern and to separate out, because symptoms are so common to all of these. But again, the best thing to do is to call your doctor's office, explain your symptoms. They'll ask you a series of questions, and they can best determine what the problem is, more than likely.
Thank you so much. Chief Partita?
I'd like to add something about the fourth dose. So we do get quite a bit of inquiry about the fourth dose, and we are administering the fourth dose for patients who are immunocompromised, or patients who come in with a prescription from their doctor, and the doctor has seen where it's medically necessary for the patient to get the fourth dose. Thank you.
Chief Partita?
Yes.
Can you please address again the city's current protocols for cleaning workspaces, common spaces, and facilities?
Yes. The city and all employees are better prepared as we go into multiple years of dealing with COVID. The difference today, especially with local governments, is that we are better equipped. We have more resources available to govern and to serve. Our city employees have COVID tests available, vaccination information. We also have clean workspaces, sanitized buildings, and our common areas. And we also have temperature scanners at all our entrances. And we supply team members with masks, hand sanitizer, wipes, social distancing guidelines, and other essential resources.
Thank you. Is it safe for residents or members of the public to attend city council meetings or other public meetings at this time?
Yes, it is safe with the precautions that are in place. It is safe to attend the meetings. And hand sanitizers. So all that is available when you come to council meetings. We have PPE areas where you can use PPE, get PPE, and use hand sanitizers.
Can you again remind our residents how they can get PPE from the city if they need it?
Sure. You can go to our website, and Communications does a really great job of posting contact numbers and where you can get a kit. We also have a phone number that you can call if you can't get to the website for those that want to call in. That number is 281-403-8500. And so you can call that number, and we will make sure that you get a PPE kit.
What precautions are being taken for people coming into the city's buildings for permits and applications?
It's the same precautions. We make PPE available, mask available. We have hand sanitizer, and of course our temperature scanners. So we have all precautions in place when coming into our buildings.
Is the city testing employees and council members for COVID-19 at this time?
We follow CDC guidelines, and of course with the direction of our health authority, Dr. Anzaldúa, we have tests available for our employees as well. So we do provide testing, and then they go through, if they test positive, they go through our human resource COVID protocol, and they're managed that way.
So the flu numbers were down last year, but this year we're hearing about more people catching the flu. Does the city have a plan at all to address two simultaneous pandemics if need be, meaning employees with COVID and employees with the flu?
Yeah, we still are urging all citizens to get vaccinated and boosted against COVID-19, but we also recommend flu vaccines that are available for anyone at the age six months or older. The CDC recommends getting the flu vaccine every season, especially for people at higher risk, such as pregnant women, adults 65 age or older, and adults with chronic health conditions such as asthma, heart disease, or diabetes.
Can you also share again the daily numbers and the breakdown by county for Missouri City areas?
Sure. Those numbers, I'm sorry, I left them right over here, excuse me one second.
That's okay. Thank you, Chief.
So our statistics for numbers in Missouri City today are, in Missouri City is 1,876, with, in the Fort Bend County area of Missouri City, 1,767, and in the Harris County portion, 109 cases.
Can you share free testing sites in Fort Bend County?
I have a list of a few that I can outline. Like Dr. Mona Finley mentioned, there's a couple of new ones that have popped up that are great locations. An additional one is the Del Mar Stadium on Highway 90, I believe, Main Street, and also the Mercer Stadium. But in addition to that, Fort Bend County has 4 existing sites that they've been providing free COVID testing. One is at North Katy Annex at 22333 Grand Corner Drive in Katy, and that's open from Monday through Friday, 8 to 5. The second is a Rosenberg Annex at 4520 Reading Road, Rosenberg, open Monday through Friday, 8 to 5, and Saturdays, 10 to 2. And the third is on 5th Street Community Center between Missouri City and Stafford. That's at 3110 5th Street, Monday through Friday, 10 to 6, and Saturdays, 10 to 2. And the final one on my list is the Four Corners Community Center in Sugarland at 15700 Old Richmond Road, which is testing on Tuesdays through Friday, 10 to 6 p.m., and Saturdays, 10 to 2 p.m.
So one of the viewers is asking if the numbers and the breakdown is the same as yesterday, or have they changed?
They change. They have been changing daily. So going to it's on the main page of our city website. Communications updates those numbers daily, and those numbers are provided through our Emergency Operations Center, through our emergency manager, Tramika Jewett. So those are accurate and up to date on a daily basis.
And that's as of yesterday, January 4th, or today?
I believe the numbers that I received were for today.
Today, January 5th. Okay, thank you so much, Chief.
Yes, sir.
In less than 2 months, we talked about this earlier, the 2-year anniversary of coronavirus being officially recognized in the U.S. will occur. What would you say is the difference between operations today versus that time?
I think like I mentioned earlier, we're better prepared. If I have to compare to last year around this time, vaccinations were increasing at that time. While we had the same spike from the holidays, and numbers were coming down quickly. And if I recall, our Emergency Operations Center was winding down right around March. So numbers were looking good, and we started to come down right about March.
And can you share any insight on what the difference is between the rapid and non-rapid test?
I think for details on that, I'm going to turn it over to Dr. Finley or Dr. Anzaldúa.
The rapid test usually gets your results in an average of 15 minutes. The PCR test can take anywhere from 24 to 48 hours.
And is there any difference in the quality of results?
The PCR test is a little bit more accurate than the rapid test. There's a difference.
Thank you so much. Can Harris County residents get tested in Fort Bend County?
Yes.
And vice versa?
They can vice versa. They can get tested anywhere. So I recommend they go to those websites and register, or look for these sites that are doing drive-throughs or doing testing without appointments.
And we're also posting the great information you shared on the city's Facebook page tonight, and we'll add those to the city's website as well, just in case anyone missed those addresses. So thank you for sharing
Yes,
that,
ma'am.
that information, Chief. And at this time, there are no other questions. Thank you very much, everyone.
All right, we thank you for all your questions, and I want to thank especially our panel of experts for their presentations and responses. This has been a great discussion, and you can count on us to provide updates as we work to prevent the spread of the virus. With that, I want to say to have a good evening, and please stay safe.